Well, this morning will be my last for a little bit here on 9 News Mornings. Next week, I'm having a procedure done to address a vocal cord injury. So I wanted to share a little bit more this morning about what's happening with the help of our 9 News medical expert, Dr. Payal Kohli. Dr. Kohli, thanks for joining me this morning.
Good morning, Erica.
So we've heard of, different injuries to the vocal cords. This was one I hadn't heard of. I've heard of polyps and other things like that. So can you dive in a little bit about what a vocal cord cyst is and talk a bit about the symptoms for it?
So it's our vocal cords are sort of the gatekeepers to our airways. They sit at the top of our trachea right here, and they're working all day long. When we're talking, when we're breathing, when we're eating, the vocal cords are moving. So what happens when you get a cyst is essentially an injury pattern. So anything that causes injury to the vocal cords, whether it's from a virus, whether it's from something like acid reflux, something even like allergies. If we have a postnasal drip, it's constantly dripping into our lungs. All of that creates inflammation of the vocal cords and can cause this little fluid-filled sac on the vocal cords called a cyst. Now, depending on the size of the cyst, you can have sort of different symptoms. You mentioned raspiness.
Yeah, very raspy. I lose my voice really easily. So, yeah.
So changes in voice is most common, but sometimes people also get kind of breathlessness or get what's called talking fatigue, where they get tired when they talk for long periods of time.
I definitely have noticed that in my job, and so that's why I have to address the problem. So we talked a little bit about the causes. You said reflux, which is something that I have. Kind of dive into some other things, because my doctor as well was saying there was some sort of injury that happened.
So sometimes we'll get an injury from a virus. So some of our viruses, as you know, we lose our voice with the virus, and that means you get inflammation or swelling of the vocal cords. We talked about allergies, we talked about reflux. Anyone who might have had a procedure before where they get a breathing tube that gets put in, the breathing tube goes in through the vocal cords. So any kind of trauma to the vocal cords, or even if you get a food particle stuck or something like that, that can initiate sort of that injury process. We don't completely understand the causes for why people get this. And as you said, sometimes it can manifest as a polyp, sometimes as a cyst, sometimes just as thickening of the vocal cords, sort of in different ways. But our voice is so important to who we are, especially for you, that it's just it's a significant diagnosis.
Absolutely. So talking about diagnosing this, they do this scope. I want you to talk about it. It's a very unpleasant experience.
So it's called a laryngoscopy, where they basically kind of numb up your mouth and throat, and then they put a camera in to look at how those vocal cords are moving, whether they're swollen, whether there's anything stuck on it. And there's other fancy tests that they can actually look to measure the function of the vocal cords. And again, it's a difficult test to do because they sort of have to sedate you a little bit to do it, but they want you to be talking and everything so that they can see how those vocal cords move.
We're just about out of time. We've got about 30 seconds. Obviously, it's a long road to recovery for me, so just a little touch on that as well.
Yeah, so what they're going to do is they're going to put you under anesthesia, probably put in a breathing tube so that those vocal cords aren't moving. They can kind of focus on it, hopefully pop off that cyst. And then after that, you really got to rest them because they're healing, right? You can't make something work that's healing. So that means no talking, no shouting, no concerts, none of that fun stuff. And usually after it comes off, there's a full recovery. Now, some people can have change in voice, but
Thank you so much.
My pleasure.